So far, globally, there have been about 788 million doses that have been delivered, essentially covering about 5%, a little more than 5% of the global population. However, as you mentioned, that is not equal in any way, shape, or form. Here in the US, we have vaccinated more than 20% of our population that's eligible, and then you compare that with other settings where they have less than 1% of their population that's eligible vaccinated. So it's a huge issue with regards to equity.
As equity issues, and of course the other big one is the efficacy of vaccines, such a huge problem. And this really also, those on the market as well as those in production, we've seen issues with the AstraZeneca jab. Now data suggesting very different protection rates by China's domestically produced vaccine. What's the impact of these findings on global confidence?
It's a real challenge, and you hit it right on the head. It's an issue with confidence. When there's more than one product on the market, people are going to shop for what they think is the quote unquote best product. And at this point, because we're in the middle of a pandemic, what we really want to do from a confidence perspective is really encourage people that if they're offered a vaccine, to get it. A vaccine is going to offer some protection. There are some differences. However, I think most of us that work in public health and that are working against this pandemic would argue that it's really important for people to get any vaccine product that's available to them at the moment.
And yet, so many still point to such data as a means of justifying their reluctance to get the jab, don't they?
Absolutely. We've seen hesitancy, which essentially those are individuals that either want to delay or refuse vaccines. And it's usually having to do with safety as well as confidence. And that's really the real reason why we have not reached herd immunity or community immunity. And we've been able to break this pandemic. And until we reach there, we have to continue to communicate to those vaccine hesitant individuals and try to persuade them as to why it is important for them to get a vaccine.
So communication, the issue here. Now, because these coronavirus vaccines are so new, should we expect new studies to continually question previous findings, and especially now that the virus is mutating?
Absolutely. The new strains are causing a lot of challenges with regards to infectivity in the models with regards to forecasting. We've seen that with any other new vaccine product, that there's some reluctance because people do say it's a new product. I want to wait. I want to see how others are faring from it. However, the difference I would say is that we are in the middle of a pandemic, and in other vaccines, such as the HPV vaccine, for example, we weren't in the middle of a pandemic. And so it's a bit of a different time.
Rupali, we talk a lot about the challenges with rollout and safety, but there's one other thing that, we have to sometimes take stock and ask, how are we doing? Because 1 year ago when this all began, can you imagine we are where we are today? I mean, with several vaccines in the market and, it being rolled out across the world.
I personally, as a public health scientist, I think it's a miracle that we've been able to get products to the market, therapeutic products to the market as quickly as we have. And not only that, but more than one. And these products are also going to be affordable because of the COVAX mechanism. And so I think you're right. I think we have to really take stock and say, look at what we have done, look at what science can do. The key now is that we need individuals to continue to adhere to the non-pharmaceutical interventions that we're asking them, such as social distancing and still wearing a mask, until we reach these populations, the proportion of the population where we can essentially break the pandemic.
Rupali Limaye of Johns Hopkins University, we thank you so much for your time and insight.
Thank you so much.